It's not necessarily some evil cabal that wants to really limit healthcare access in North Carolina. These are reasonable people in charge of their own singular institutions, and they have the economics that they have. They're just fighting to maintain.
Hi, and welcome back to The Debrief. I'm Donna King. I'm editor-in-chief of the Carolina Journal. I'm so glad you're with us. We are really following this very closely, something called Certificate of Need, but really it's about the skyrocketing cost of healthcare in North Carolina. We've got some new information about that. We'll be talking about that today, but we want to know how it's impacting your family. Make sure you subscribe, comment below, and let us know what you think about the cost of healthcare where you live. Joining us this week, of course, we have CJ's own Jeff Moore and Brianna Kramer, who's been covering the state legislature. Brianna, we kind of delayed recording today because we're watching the Certificate of Need bill in the North Carolina Senate really closely. Kind of thought it might pop up because it went through rules today. No
That's
dice.
Right. No, it did get through the Senate Rules Committee on Thursday morning, but no, it did not end up going to the Senate floor for a vote today. And really it is aiming this bill to totally get rid of Certificate of Need laws in North Carolina to just help take away all the red tape that is currently in our healthcare system and really just try to lower costs. That's a big thing that both chambers are focused on this session. They both have introduced different healthcare bills as well as the Certificate of Need bill, just really trying to lower costs because North Carolina is one of the most expensive states in the country for healthcare.
That's crazy to me because we've worked so hard to keep taxes low, to keep cost of living low. It's a great place to live. I mean, our family has always seen this as this perfect little gem on the East Coast where you can live affordably here. But healthcare, out of control. Certificate of Need, if you don't know what that is, that's the permission slip that we're talking about, that the industry has to get a government permission to buy an MRI at a hospital bed. What do you think the impact is?
Yeah, so it's huge. I mean, one of the reasons that we stay elevated at that level is because the supply of healthcare and the providers are so restricted in the state because of this Certificate of Need regime. So like you said, for anything you can think of when you're pursuing healthcare, it's probably regulated by that Certificate of Need structure. And if you're going to get an MRI, if you want to get a knee replacement, and the doctor that does the knee replacements wants to open up a surgery center, he's got to get a Certificate of Need to do that. The local county hospital probably has a vote on whether or not they approve or reject a Certificate of Need for something that will directly compete with them in their surgery center at the hospital.
So the hospitals get to choose who competes against them.
Yeah, so they have an incentive to block out the competition. And they're, they're protecting their bottom line. A hospital treats people in so many different categories, and in so many of those categories, they may lose money. Other categories, they may actually make money, and it's what keeps the hospital afloat. And so they want to protect their ability to make money in those avenues that they do. And if you have doctors or facilities coming in applying for certificates of need to actually compete with them, they're incentivized to go against that. So what looks good to the hospital CFO may not be good for the actual county residents who are seeking health care, who may actually have to go out of their county to go to get some more elevated services there. So it really has this trickle-down effect throughout the whole kind of healthcare ecosystem. Contributing to those high costs and really frustrating a lot of providers who have the ability to actually treat and provide the services to these people. We were talking earlier about the MRI machine. That's one of the things regulated by Certificate of Need. The technology for the MRI has existed for decades. The ability to produce the machines, to purchase the machines, and to offer those scans there's no actual tangible restriction on that. A provider could do that. I believe there's a provider in North Carolina, Winston-Salem or Greensboro, that actually tried to open up an imaging center to offer more economically priced MRIs and scans of that nature. But the lawsuits and the Certificate of Need costs started piling up so much that he wasn't able to do it. So it is really frustrating. We think in North Carolina, with all of our kind of research and medical school universities that we have, especially around the Triangle, we think, oh, well, we're full of healthcare options. It's a little bit paradoxical to hear that we're the most expensive market for healthcare because we have a lot of access to different things, especially
but it's a powerful
in the metro
industry.
Yeah, it's super powerful, and they're the maybe the best represented lobby on Jones Street is representative of all the different pieces of the healthcare industry.
The only way I can describe it is this would be like if a plumber had to get permission to get a, the snake thing on the wheel that they have to bring to your house after Thanksgiving. I mean, it'd be like if you think the market can bear it, you can get a loan to buy it and you can offer it to the public, you should be able to do it just like any other industry.
Yeah, or if literally just there's one plumber that got the certificate in the first place, and another a young man is trained to be a plumber and wants to buy some equipment and actually offer his services. But the original plumber would have a vote on whether or not he's actually allowed to get that certificate or that occupational license or what have you.
So crazy.
So yeah, it's really restrictive, which is why just in general, moving towards more limited government where they have less involvement in the markets that you're operating in, whatever market that is, whether it's plumbing or healthcare, is for the better, because in the end it'll be better for the producers and the consumers to actually get to the goal that they want to reach, which is a mutual exchange for mutual benefit without a bureaucrat saying, no, you can't do that.
Right. So if they get a certificate of need, does that mean necessarily there's going to be an MRI or an extra hospital bed?
Hopefully so.
Yeah.
I mean, hopefully that
takes
away the government overreach within the process and allows counties to actually, adjust for their current demands and allow more people to get into the market. But there is pushback, of course. During the committee meeting, the public was allowed to speak, and so one person did come forward representing hospice and say that they are not in favor of repealing.
Really? What was the reason?
Basically for hospice and for home care services, because they would just like to see these certificate of need laws stay in place for the betterment of regulating this industry and making sure that the care and standards are upheld.
So they were afraid that without certificate of need, quality of care would drop?
Yeah, that's what they were saying, and the only one to speak against it in today's committee meeting, but definitely something that lobbyists in the healthcare industry are conflicted with as well.
That's an interesting point. We heard about this a lot going back to the whole Medicaid expansion debate that we talked about. I want to know what you think while we're talking. Please join in. We want to hear from you. What do you think about this, particularly if you're in the healthcare industry? Tell us what this means. What does certificate mean for you and your business and all of those things? We heard about this with Medicaid expansion, that rural hospitals were going to go under. This is where the bread and butter was for them, things like MRIs and knee replacements by insured people. What do you think about that argument?
Yeah, so if you're the hospital CFO, that makes a lot of sense.
Sure.
So you're protecting your bottom line. You offer different services. You're bleeding money in these areas. You're making money in these areas. You want to protect those streams of income that are actually coming in. And so the lobby for Medicaid expansion a couple of years ago was that if you didn't expand Medicaid and get those extra dollars coming in for people that are actually insured, because the hospitals are treating them anyway.
Sure.
So they're coming in insured or not, they're getting some treatment at the hospitals. If you didn't expand Medicaid, it's going to really threaten the viability of a lot of the rural hospitals, the single standing county hospitals that may be in trouble. But overall, and you would think if you opened up certificate of need completely, that you would actually have a diversity of services offered in a lot of these areas.
You can absorb all those people who are now on the rolls.
Yeah, so the economics of it are not, they're not simple oftentimes.
Sure.
Healthcare is so regulated and the streams of income are so predicated on third-party payers that it gets very complicated. So it's not necessarily some evil cabal that wants to really limit healthcare access in North Carolina. These are reasonable people in charge of their own singular institutions, and they have the economics that they have.
Sure.
And so they're just fighting to maintain.
All right, we're going to be watching this really closely. Both the Senate and the House, is that correct?
Yeah.
They both have companion bills to repeal certificate of need. I don't know if there's a use it or lose it component to it, but really it would repeal it entirely. So keep an eye on both of those. We'll be updating you on CarolinaJournal.com as those bills move through the legislature. What else are you watching?
Yeah, there's a lot happening this week. The Senate elected Senate leader, or now the Senate Majority Leader, Michael Lee, to replace Senator Paul Newton as he exited last week in the Senate. So that's new in the Senate. some interesting bills that they were passed through this week. A constitutional amendment could be on the ballot maybe in 2026 if it goes through both chambers, dealing with council of state vacancies. So basically how the governor chooses to fill an empty seat, whether that's the state auditor leaving or any of the executive branch seats. So right now the governor has the sole authority to put somebody into that place, and so this constitutional amendment that they're considering would allow the political party that the former person was a part of to choose who to replace.
These individually elected members of the Council of State are Republican or Democrat or whatever.
Right. So the political party, so the Republican Party would be able to set forth 3 different nominees for the governor to choose from if, say, Dave Bullock was to leave office.
What happens now?
Right now, it's the governor's
He could pick
authority.
whoever he wants.
That's right. So part of the problem with this, experts say, is that you're really leaving this very partisan. You're only allowing the governor the discretion when voters chose a Republican for state auditor. So really, it's just trying to give voters their voice, even if somebody is leaving office. Back in November, this actually happened, where the former labor commissioner, he left office the day after the election. And then the next Republican, that was Luke Farley, that was going to take office. He was elected, but in the meantime, Governor Cooper appointed a Democrat for just those couple months.
So I didn't realize that. So between the November election to the time Luke Farley was sworn in, Cooper appointed a Democrat to fill in that gap.
Yeah, even though voters obviously showed that they wanted a Republican in the previous election and in the 2024 election.
Interesting.
So it would just, allow voters to still make their voice heard when it comes to nominating vacant seats.
Okay, where is that bill now?
So that's in the House right now. It was in the Judiciary Committee on Tuesday. So it was approved. It's moving forward. Just an interesting one on the constitutional amendment process. So that would go to the ballot if it were to pass.
All right, good to know.
Yeah, another one in the House is called the Ensuring Non-Discrimination in Disaster Recovery Assistance. So this goes back to November after Hurricane Helene hit and FEMA's response in the disaster recovery. And, all those reports were circulating that they were discriminating based on political parties, if you had a Trump sign in your yard, things like that. And so that kind of went viral.
They would say they would avoid bringing help. Bringing help to them if they had a sign out front.
Yeah, that's right. And so this is kind of in response to that, making it a Class 1 felony and then explicitly prohibiting discrimination based on political affiliation or speech in the administration of state disaster recovery aid. So that passed the House, so on to the Senate. Yeah, that's.
Do you think there's an appetite on the Senate side for this?
I would be a little bit more hesitant on the Senate side for this, but I mean, it was an important issue when it comes to disaster recovery, and we even had Senators Tom Tillis and Ted Budd speaking out about this last year. So it made national headlines and was a major issue. So I think there is an appetite. We'll see how far along it can get in the next couple months.
We'll be following that really closely. I got to show y'all some video that we took. We had a great opportunity to go out to Fayetteville and visit with the School of Hope. They're in Fayetteville serving a fantastic population of families. Amy Sparks, it's a great name for her. Sparks is just everything you feel when you meet her. She's running a school in Fayetteville, School of Hope, for kids who are dealing with learning differences and many of them with autism. She's doing amazing work there, and she says that she could not do this without the Opportunity Scholarship.
There's Trish. Trish, can you show us the stack?
Okay.
That's all applicants?
That's all applicants. This year, all these kids, I just was finishing a tour with another lady who wants her son here this year. If they can't get in, they're dealing with homeschool or public school. They want to know that they can have the scholarship. And if they have that guarantee, then we can move forward. And we have a building out there that's waiting to be put together. And we have land that we've already purchased and bought. And that way we can service our children. Every single child that comes to this school has the diagnosis of autism. We're the ones that have to look in the parents' eyes when they're crying.
Yeah, of course.
And they're saying, you're our last hope. What do we do? This is a school specifically catered for children who have autism.
Just amazing work that she's doing out there. One of the things that she told us is that she's got, well, one, you saw that big drawer of applicants. She's got long waiting list. 95% of the kids that she deals with are on an opportunity scholarship. But the biggest challenge that she has right now is she can't grow and she can't expand because it's hard to get construction loans and all of those other things when you don't know if 95% of your kids are going to have that scholarship the next year. So there's some real economics to running some of these schools. But the biggest thing I took away from this was these are not wealthy families.
No.
That's the narrative that we're hearing from people who are opposing the Opportunity Scholarship. They're saying, oh, this is for, now it's for rich kids to send their kids to private school. It's just not the narrative. I still to this day have never, as long as we've been reporting on Opportunity Scholarships, have never met a 1% or high wealthy family using this program. It's easy to make that narrative, but until you go to places like School of Hope, you don't know.
Yeah, it is. And obviously the program started, I think this has probably helped cultivate that narrative a little bit because the program started with the lower income. They expanded it to higher income, and you have a lot of applicants in those tier, the tier 3 especially, and less so in the tier 4, the highest income tier.
Right.
But when you open it up, you kind of open it up to some of that criticism of the class-based stuff from the left. A convenient kind of memory hole in all of this is that the people they may criticize for taking some of this tax money to put it toward a private school in the highest tiers, those are the people that are paying the taxes.
Right.
So that should be said first and foremost. But it is easy to throw rocks when you're not really in control and everything. So Democrats in this case have been in the minority for a long time, and in opposition, it's easy to just tear stuff down. It's not as easy to build stuff up. So if you're in control of the state legislature for the last several years and you have student scores in math and reading and science going the directions they're going, even while the funding of education in the state is going up for the public schools, then you are actually forced to pragmatically view that problem and look for a solution, and school choice is often the best solution, just to give the parents and the family some choice in where they take those tax dollars, attach it to the child, and actually have that follow them around to wherever it's going to be the best situation for them. So it is easy to oppose it. Opposition is easy. I have an editorial this week about this. That opposition is easy. It's much more of a burden to build things up. But when you are in the minority, and the Democrats have been there in the state legislature for some time now, so they've gotten quite used to this. We've seen a lot of it this year, and I'm sure that you've seen a lot of it too, having to follow some of these press conferences.
Right.
Is that you don't have the consequences to really carry of leadership and actual governance. Governance is actually hard, but you can file bills like the Menstrual Equity for All Act, which was filed last week, or in-state tuition.
What is menstrual equity?
I think it is to put tampons in all of the bathrooms, regardless of the gender, because of some of the gender dysphoria
in North Carolina?
stuff. That they filed a bill to that effect. Yes, so menstrual equity for all. In-state tuition for illegal aliens was another one that was filed. And so these things they're not for, it's for attention, not to achieve an end. No matter the long odds that these bills face, they have a press conference for every one. So it's just drumming up attention. Some of it is understandable. If you're elected to a seat and representing your district and you are in the minority, your constituents still expect you to take some action, do something.
Absolutely.
So when you don't have any real power, then the best thing for you to do is to be loud and to criticize, kind of throw rocks at the majority and what they're doing. So that is par for the course. We're seeing it again this year in the General Assembly with really like a gauntlet of different bills that, and they got some run in some of the drive-by media as far as giving the lawmakers the attention that they were seeking there with these press conferences.
Do you think they're painting a picture of this is what we would do if we were in charge?
Yeah, it's a glimpse of that. It changes some because the reality of governing being so hard. So you have some of this on the other side too. It's not exclusive to Democrats or Republicans. If Republicans were in the minority, then you better believe there's going to be some bills that they actually propose. That if they're in the majority, they actually don't carry water for those bills. And we see that some too, that some things are uttered on the campaign trail that never quite make it through the halls of the legislature. Certificate of need repeal, full repeal is something that's been talked about in conservative circles and at the grassroots level for years, but we've yet to see a bill actually get across the finish line. But when you're in the majority, that governing is more hard. You can get a glimpse of what they would actually do by the bills they see, but when you're in the minority. But because there are no consequences, they don't have to actually really balance the pragmatism of, can I whip enough votes for this? Is this going to hurt me in another area? When you're in the majority and in control, you have balance, budgets to balance and negotiations to have. You have like more feasible policy solutions that you actually want to get across the finish line. So it is a glimpse of what they could do. It should always be tempered a little bit because realizing that when you actually have control, it's not as easy. So that's why opposition is so easy. They have all they're required to do really is gain attention and rabble-rouse and then say, re-elect me again so I can complain more about what the majority is doing, and that's what we see here in North Carolina.
Like a new, I think I saw one for a new minimum wage.
Yes, the $22 an hour minimum wage.
$22 an hour.
Yeah, which is sometimes unfortunate because these do gain traction and they get the media attention that they're looking for.
Right.
But it ends up being misleading because North Carolina is not going to raise the minimum wage to $22 an hour, and that bill's not going to go forward. But I saw online a lot of people liking it or just commenting, talking about it, either way, debating it, but not really understanding, you know, the layout of the North Carolina General Assembly and not really knowing that like this isn't actually going to go anywhere.
What are you seeing in that mood between the two parties and the two sides of the aisle? Are they working together on things, or is it more of a rabble-rousing file bills that get media attention kind of thing?
I think there's certain groups that can, or certain people that can work together.
It depends on personality, imagine.
It does. And then certain people that are just there for a press conference to make a statement. But I have seen that some Democrats are working with Republicans. This week, for example, Representative Chester introduced a foster care bill. A very comprehensive bill, and that was a very bipartisan effort with the support of Democrats in the House. And so, you know, if they want to have, you know, a bipartisan effort, they can come together on something so important like foster care.
It's so important. Sydney Batch worked on that for a long time, and that is so important. We have a really broken foster care system in North Carolina. We'll certainly be talking more about that as that bill moves forward. And we saw, you know, Pricey Harrison filed the bill on transparency in the public records. There's definitely some traction on that side, but I'd like to see more, certainly.
Yeah, I think we will see a little bit more working together, especially with Governor Josh Stein now. Like as those bills move forward, we'll have to see them cross the line a little bit to accomplish some things.
All right, make sure you head over to CarolinaJournal.com, catch up on all of these things, some fantastic opinion columns, good analysis. We want to hear from you. Subscribe. We're going to bring this to you every week, and we want to know what you think. So make sure you comment below. Thanks so much. Did you learn something? Make sure you subscribe to Carolina Journal's YouTube channel and watch the debrief every week, where we're going to be breaking down everything happening in your state government. And check out CarolinaJournal.com for the latest breaking news.